Back to NBC LX, I'm Jobeth Devera. May is Mental Health Awareness Month, and every year, millions of people face the reality of living with a mental illness, which is why we spend a lot of time here on NBC LX focusing on taking care of our minds and our bodies. So let me throw some numbers at you real quick. New data released from the National Alliance on Mental Illness shows back in 2019, about 20% of adults here in the U.S., or roughly 50 million people, experienced mental illness. But less than half of them received any kind of treatment. We also learned about 50% of mental illness starts by the age of 14, and about 75% of mental illness by the age of 24. Also, people with a mental illness, they're more likely to commit suicide. LGBTQ children are 4 times more likely to attempt suicide than straight children. This is still data from the National Alliance on Mental Illness. And when it comes to the homeless, at least 20% have a serious mental health condition. For those in prison and the incarcerated, about 37% have been diagnosed with a mental illness. And you can imagine things have gotten a lot worse for many people during this last year of social distancing and isolation. So how can we all better address mental health? Here to help give us some answers is clinical psychologist Regine Muradian. Thank you for your time today, Regine. Can we just start with what exactly defines a mental illness, and can you give us some examples?
So I think I just want to jump right into this just coming out of this pandemic and what people have been feeling. And for example, anxiety is a perfect example. We've all been feeling anxious about returning to work, returning back to school, coming out of this year-long pandemic. I have been somewhat describing it as a form of non-moving fatigue, which is a decrease in our normal way of life and our normal functioning. So when I think about mental illness, when we are feeling a change in our daily environment that we cannot handle, we are having trouble getting out of bed, we are having trouble just doing our daily life activities, for example, like anxiety, depression, eating disorders, or whatever it is that that person is experiencing that is taking over their life, and they just can no longer function as they used to, then I really suggest seeking help and support and seeing if it is something that they need treatment with.
Okay, so you did answer my question there. So anxiety, depression, those are signs of mental health illnesses, right? Those are just some of the examples?
Yes.
Okay. So as a psychologist yourself, when you have patients come to you and they talk to you about their problems, what are some of the more common issues or conversations that you have with them who are experiencing a mental illness that maybe they did not know that they had?
So one of the most common ones that I see is anxiety. Executive functioning issues, certainly depression, definitely a lot of suicidal thoughts and negative thinking, especially now. I mean, it's been such an increase, not just myself, but many of my colleagues as well, as a result of coming out or this pandemic since March 2020. And I think it is due to all these changes that we have all been experiencing, working from home,
Right.
Changes in our environment, having kids on Zoom, and all the shifting that has occurred has certainly increased a lot of the symptoms in people.
So what do you tell them? What's the solution here to decreasing stress, decreasing depression and anxiety surrounding all of this?
Yeah, so I'm really, I come from a perspective of using mindfulness. I think it's really important, and being mindful and being in the present. And some examples are journaling your feelings. That can be a really powerful tool in creating change. I think also the first step, and this is why I really empower people to seek support and help, because just journaling your feelings is like an example of writing it down, but expressing and talking to someone can be so helpful. The other piece is creating a daily exercise routine. So important. I think that now that we're coming out of this pandemic, we haven't been moving like we used to. The other thing is I'm finding is a lot of fear, right, around COVID, or a lot of fear of reintegrating into society. So starting slow and also being okay with saying no if you don't feel comfortable with something. Because at the end of the day, if we think just about anxiety in general, it's all about control and feeling like you can make decisions for yourself and just taking it step by step. So for me, it's all about empowering people and helping them feel that they have that control in that decision making.
But that is another problem in this whole step, that a lot of people are not going out there to seek treatment or to go talk to a counselor or talk to a psychologist. Why is that? And what do you think needs to change?
Yes, I think the first step is recognizing that there's an issue. Recognizing within yourself, if you're noticing that you're more anxious than usual, or you're noticing that you're feeling depressed more than usual, I think it's such a great step to just like a common site that I just love is psychologytoday.com. And also reaching out to somebody maybe that you feel comfortable speaking with as a first step and just trying it out. Now, a lot of times I think, and this is what May is all about, and I try to talk so much about it, is decreasing the mental health stigma around mental health, that
Right.
something is wrong with me. It's all about normalizing. I tell this to my clients all the time, is that everyone should seek support. We all need it. And that's the beauty of therapy, is you're in a safe environment. It's confidential. And there's no judgment. And I think that's one of the beautiful powers of therapy, coaching, cognitive behavioral therapy, whatever it is that the person needs.
Yeah, so very important to break that stigma and remember that you are not alone. We all have problems, right? It ranges from different little things to bigger things, but it's all about how you approach the problems, how you view the problems, and your perspective. Very insightful information, Regine Meridian. Thank you so much for joining us here today.
Thank you for having me.